Hello there. Welcome to Dr. Dan Med TV. Happy New Year.
Thank you.
So today we're going to be discussing something very interesting. We're going to be discussing, you as a medical doctor discussing a patient with relations abroad.
All right.
Yeah.
So,
with the advent of jackpot syndrome, every client or patient right now seems to have someone who is a medical professional abroad. So, and there are instances when, there's like conflict, and it's looking like it's not in the best interest of the patient. So there have been instances, let me use myself as an example. There have been instances a patient walks into my consulting room with their relations or families, and the patient sits down. I'm starting to collect the patient, and the next thing is they want to hand me a phone that there's someone abroad who wants to speak with me. I've not even assessed the patient. I don't know what the diagnosis is. The next thing, they want to speak with me. And many times I just say, I'm not interested. I don't want to speak with anybody. Let me assess properly. And if I have time or when I'm chanced, I'm going to speak with the person. And sometimes when you even speak with those people, you realize they are not even doctors. They are not medical doctors. They're just some people maybe an allied health worker, or something that is speaking with you, and you are not in sync. And sometimes they're actually doctors, but they fail to realize that your practice is different from theirs. There's an international or global acceptable standard of practice. But at the end of the day, you still have to adapt your practice to your environment, given the resources that you have at hand.
Yeah.
So what's your take on this?
Yeah, we have those kind of situations every day. I think to start with, I'll divide those scenarios into two.
Okay.
One, you have people who just look down on you because they feel they're in Europe, they're in the US, and because of that, they are at a higher pedestal than you, and so they want to talk down on you.
Obviously.
Yes. So that's one set of people.
Okay.
And there are some other sets of people that they don't really want to talk down on you or anything.
Mm-hmm.
It's just a question of
they're worried.
They are worried, and then there's a problem with communication.
Yep.
Just a question of communication, probably because of even if they are medical people, maybe their specialties are different.
Yeah.
And maybe they are not even medical people.
Yeah.
So those are the things that might give us some challenges in
okay.
communication.
All right. Communication is very important. I'm happy that you mentioned it. Someone who is abroad actually is anxious, wants to know what's going on,
Yeah.
and for those who are medical practitioners, there are many quacks in Nigeria. I hope my patient has not fallen in the wrong hands. So they have legitimate, and there are concerns about all these things. But the way they go about it can determine whether it's in the interest of the patient, or at the end of the day, what they're doing is going to cause some problems in the management of the patient. So how do you think in the interest of the patient, because at the end of the day, I'm sure the doctor wants the patient better, the relation abroad, the medical professional abroad wants the same thing. Yeah. The relations here also want the same. In fact, the patient wants to be well. So how do we synergize and synchronize to get this properly done?
Yeah, so just in line with what I said earlier, one, if you are interested in discussing with me, the doctor in Nigeria, first you must introduce yourself.
Yeah, let's know who you are.
Yes, you must know who you are. Are you a barber? Not because barbers should be looked down on.
No.
But I don't expect you as a barber to have the same knowledge that a nurse will have, for example. If you're a nurse, don't say you're a doctor. because they are different.
The way we think,
The way we think
they are
is
different.
Like I was saying, I spoke to an orthopedic surgeon a few days ago, and he is not a general surgeon, but he's an orthopedic surgeon. We were able to, in fact, within 1 or 2 minutes, I'm sure the relations in Nigeria were wondering how we were able to speak like that.
You know?
Oh, he just said, "Oh, doctor, yes, I agree with you. Please go ahead." I mean, that's the way it's supposed to be. So introduce yourself.
Okay, so I wanted to I want to add something to that. That even for doctors, the fact that you are not in the same specialty
it also
can
matters.
can matter.
Yeah.
The orthopedic surgeon, you're a general surgeon. Somehow you found a common language or for someone who is a physician, maybe an internist, an internal physician, a nephrologist,
Yes.
talking to a general surgeon,
Exactly.
may not, the person over there would need to calm down to understand the perspective of the other person for them to reach a common ground.
So that's first, introduce yourself. Secondly, both parties. First, the party that is outside the country, because you are the one that needs information. So you must come from a place of humility, not from a place of
arrogance.
Arrogance and saying, "Well, I know more than those guys in Nigeria. What do they know? What do they have?" No, don't come from that place. Don't come from that pedestal. The same thing. So once you do that, there's a tendency that the person in Nigeria too will come down to that same level.
Yeah.
So if you are calling me from Europe and you say, "Oh, doctor, I'm really grateful for the way you've been taking care of our Baba there, but please, I have a few concerns. I noticed that this showed up in the test results. Don't you think we could do this?"
Yeah.
I will probably listen to you better than if you just say, "Doctor, I don't like the way you have." No.
Yeah.
And then
Okay.
doctor in Nigeria too should be in a position to accept and also reason and say, "Okay, yeah, I agree with you. We did that because of the constraints we have here." You know? And then the discussion should go that way. Yeah, so everybody is going to be happy. But if you just come and say, "No, you can't manage my father like that," of course, I'm not. In fact, sometimes many people would refuse to speak with the person abroad because of their previous experiences. It's just that nowadays, this modern day practice, every doctor should be able to speak with people over the phone, over the internet, to pass information across. But it must be done the right way. It's not like the example you gave when I'm discussing with the relations here, and then someone just brings in a phone and say, "Doctor, speak to my uncle in the US." Of course, I'm not going to answer you. Because I would expect that after discussing with the relations that I can see here, you should be able to relay that information to whoever it is you want to discuss with. Because how do I know I'm even speaking with the right person?
Yes.
So I think having those things in mind would be
very important. Okay. So I think I was going to talk about the flip side of a doctor not wanting to speak to the people abroad, and they have answered that in this age and time we should be able to find a way to accommodate for that, being flexible, because they're anxious actually. They want their people here to be fine, and they're worried the things they've had, how they left the country. I hope they've not fallen in the wrong hands.
And they forget very fast.
It's easy to forget
very fast. I mean, you would see a young doctor that just finished house job, finished service, traveling out of the country, and he has forgotten the consultants he worked with and the way we used to manage patients. And now he feels that that Nigeria is very bad. Now, and the other thing to add is that he might actually go both ways, in terms of the person abroad may actually know more than the person in Nigeria. But you don't have to make the person feel inferior. There's a way you're still going to say it, because you've introduced yourself as a consultant cardiologist. And you're speaking to a medical officer. Of course, he knows you know more than him.
Yeah, of course.
But there's just a way you're going to pass your information that will make him not make him feel inferior. And it may also be the flip. I may be speaking to someone abroad who is lower in terms of knowledge base than myself, but I won't make it look like what you're saying is rubbish. No, it shouldn't be like that.
So respect from both
Yes, they
parties.
say respect
Respect,
is reciprocal.
reciprocal. Even when because you must think you are not here. It's the people here that are managing your patient.
Yeah.
So you have to show humility. And for doctors over here or medical practitioners that are here, we have to embrace humility too when we are managing such people. I hope you've gained one or two things from this discussion. Please, at the end of the day, not in a nutshell, what we're trying to say is that when we have people abroad and they want to have an input in the care of patient, there's a way it can be communicated appropriately. Introduce yourself, be humble in doing so, be nice, be respectful, and if you think that your patient has fallen in the wrong hands, you have the right to take your patient elsewhere.
Yeah.
And in fact, don't cut ties with the people you left here, because except you carry all your family members abroad with you, you still need doctors here. This is a discussion for another day. All right, thank you. This is Dr. Dami, Med TV. Please click like, share, subscribe. You'll be hearing interesting discussions that are medically related. And see you next time. God bless you. Share.